Austin Lake, co-founder of Theophilus Health, doing this video today talking about the top foods to avoid if you are experiencing chronic pain. Now, I feel like it's important to first start off by discussing just how food can actually become a negative part of your regimen or to routine that is actually contributing to your pain, and kind of explain it in a way that would make sense to a lot of people watching this video. So let's get into that. Well, right off the bat, I think it's important, like I said, to understand just how our gut plays into all this stuff. Because if you are just if you're just trying to make sense of how food could actually contribute to pain, I think from a broad perspective it could make some sense. But if you really think about it, when we're ingesting food and we're bringing food in through our mouth, obviously, and through our stomach, on our small intestine, and our colon, we're kind of like a big tube all the way throughout our whole bodies, from all the way from the top to bottom. And so if we're ingesting things that our body is not used to or not receiving very well, our body will at some point either reject it, and it'll reject it through a lot of different ways, whether it's through snot in our nose, or through our skin, through rashes, or through sweat, or through our urine, or through our feces. Our body will find a way to get rid of toxins throughout our body. The problem is if you start to store up, or if you start to bring in a lot of toxins over time, and you start just bringing them in through your food, through your diet, through environmental factors, through lack of sleep, whatever the case may be, you start to build up this toxic burden that can exist in your body. So for a lot of people, if they bring toxins in and they get them out, oftentimes they don't have any symptoms, right? If they have chronic stuffy nose or chronic runny nose, or like I said, sometimes eczema, these rashes, or they're having issues with their stool, you can start to see these early warning signs that your body's having a hard time, or it's dealing with a lot of toxins on a chronic basis. And so if you're starting to see those things, it's an indication like, maybe I'm not helping myself out through some things that I'm doing, whether it's food, supplements, or lack thereof, or just overall poor immune system health, whatever the case may be. So that's the first thing I'll talk about. If you start creating this dynamic that's known as enhanced intestinal permeability, which is known as leaky gut, and most people have heard that term. Basically what this means is as food comes from our stomach into our small intestine starts to become less able to control what is not coming into our bloodstream versus what they were able to control before. And so there's these things called tight junctions that become less tight. They open up, and now all the digestive waste, all the pathogens, all the bacteria, all the undigested food, instead of it kind of being blocked off and being restricted, now it starts to go through these open channels that go kind of right into our bloodstream. And when these things that aren't supposed to be in there, remember, we're a big tube again. This tube is supposed to be protective. If this protective tube now starts to break down and things are starting to enter into this tube and get to our body and into our bloodstream, our body is now creating antibodies to respond to these foreign invaders, so they can actually set up a defense system to attack, to break them down, and to get rid of them. Well, over time, if this happens for, let's just say, several months to years, you can start to have a big problem. And now you start to see problems with certain foods. And so for some people, I should say for most people, it's things like corn, gluten, dairy, and processed foods, sugars, artificial flavorings, and colorings. But for one of our clients, it was pickles. He was eating a lot of pickles when he had a food sensitivity, or when he had a leaky gut, that he actually developed a food sensitivity to pickles. And so now pickles became a pro-reactive, a pro-inflammatory response for his body. And so I guess what I'm saying is the top reactive foods for most people, like I said before, are usually corn. Nightshades can be a high up there in the category, so like potatoes. Eggs can be a big one for people. Dairy is a big one. Gluten, obviously. And there's some foods that can actually cross-react once they enter into your body, and they can produce different things that are even more inflammatory. And so I would say if you're experiencing things like low energy, joint pain in multiple joints, that's not really related to your activity, or you're doing things or you're not really doing anything and you're having joint pain, like that's a big sign. If you're having brain fog, if you're having a lot of anxiety, if you're having a lot of issues with your bowels, if you're having a lot of issues with your sleep, again, there's a lot of different symptoms here. But I would say if you're experiencing chronic pain, the best thing you can do, and again, this is just from my perspective with working with my clients in the past, and this is not necessarily medical advice for anyone that's listening, but if you are experiencing these things, I would strongly encourage you to pay attention to your bowel movements, pay attention to your symptoms after eating food, and typically give yourself 3 days to determine if you've had a symptom or not. Because if you had something on Wednesday and you're not having any symptoms by Saturday, I'd say you're probably doing fine with whatever food you ate. The problem is oftentimes we're ingesting so many different things that are very hard to identify what's causing our problems, that we kind of lose track and we start to get confused and we just kind of give up and say nothing really works. When in reality, we're just not following a dedicated plan to kind of get down to the root of what's causing our symptoms. So anyway, that's just a kind of a very brief overview on foods to avoid if you are having chronic pain. But I would also say if you're having chronic fatigue, brain fog, a lot of digestive symptoms, like those could all be correlated to this enhanced intestinal permeability issue as well. And so if you are having these issues, whether it's working with us or somebody else, like definitely get to the root cause of this, because you can fix this problem. You can heal your gut, and you just have to follow a very strategic plan in doing so. And you want to make sure you're doing it the right way, correctly, and that you have somebody working alongside you that can kind of guide that process. So like I said, whether it's us or somebody else, make sure you start working on these things, because they can be improved. It can actually make a huge, huge improvement with your life. And this is actually something that myself and my business partner, Dr. Wright, we both struggled with before we started this practice and before we found functional medicine. And we're actually able to heal these problems and get down to the root cause of it. And it's been a game changer for us, obviously, in a lot of different ways. So again, if this was helpful for you, like and comment, share, all those different things. And hopefully you can get to the root of your problem or somebody else's, and this will be helpful for you guys. So have a blessed day. Thanks.